So Zan made me watch The Substance last night, and I have more thoughts now that I've slept on thinking about it. So if you have watched The Substance, stay. If you haven't, there will be spoilers involved. But I have questions from a nursing healthcare perspective. So again, spoilers for The Substance. I took down the video I did last night because I've thought about it some more. First off, when she got the instructions from the thing and was pulling all the parts out of the box, and it had step 1, step 2, step 3 with just like the big bold letters and the steps, and I saw the items included in the steps, I'm like, instructions unclear. There's absolutely no way this is a do it yourself kit at home. That was before I even knew what it was involved. That was just her pulling it out of the bag. I said, there's absolutely no way. If you've ever done a discharge from a patient in a hospital and having to educate in any way, there's absolutely no way that many steps that was going to work. I had even more questions after I saw what those steps involved. That was just her pulling the stuff out of the box. I was like, IKEA bookshelves come with better directions and are less complicated. And really, no sharps box, not even a little one, none. Ew. I mean, I remember when I was learning Foley insertion and getting all those steps and sterile technique and all of that stuff and practicing. Like, there's no fucking way that would do it. Anyway, so then you see what the steps involved. Okay, why? Why do they assume that everybody can know how to do a tourniquet and just inject IV medications, raw dog it right into your vein? Like, we don't give stuff that way in the hospital. There's a reason we start a peripheral. But all of a sudden, everybody can hit their AC with no flashback. And if it glows, I'm not injecting it. I'm just saying. But again, no sharps box. There were no CCs of how much of a dose. Is it weight-based? Is it not? I don't know. And that kind of comes into play later about the dosage. But anyway, there wasn't even a line on the syringe that said "fill to here." Anywho, we'll suspend disbelief in how the other thing happens. But then you have to enter into phase 2, which is where they basically, everybody's so good at hitting veins, and they're basically giving TPN in the wrist, in the wrist, in an unsecured, just stick it in, and then the bag. No flow, no. It must be some hell of a kind of pressure because they don't hang the bag above. It just lays flat through an unsecured peripheral, and it just goes for 7 days. TPN through a wrist peripheral, because it says food. That's what that is. And I've not seen gravity be able to work laterally, but okay. I mean, I've seen those bulb IV, but you have some sort of I don't know. But anyway, they're able to start, no flash or anything, just start, and it just starts sucking it in laterally. Still no sharps box. But anyway, then there's the whole stabilized thing. Again, they just had cards like step 1, step 2, how often to do it. Again, instructions unclear. You were supposed to do the stabilizing thing. Well, then you pull out this great big old fucking needle, and then apparently you don't need a how-to list to go and get CSF from a spinal tap. You just go and pull it out like a huge, I don't know, 30, 60 cc syringe, and it does it into individual vials. How the fuck does that work? But apparently, without any instructions, and with just seeing this big ass fucking needle in these weird ass containers, you figure that goes in the back. That goes in the back that you just sewed up. You can suture up big old hole back. You also know that. Like, you pull out the starter injection kit with the tourniquet and the injection, and then there's a needle and thread, and you don't wonder what the fuck that's for. Anyway, so now with these no instructions, you've known how to give yourself an injection IV, you've known how to start TPN, you've known how to suture up huge ass wounds with what looks like a shoestring, and do a lumbar tap through said wound. And then you take a second and do the auto injector into your thigh of the daily CSF fluid. I don't know how long that keeps it stabilized. There's they're not refrigerated. And again, no needles. So I'm assuming same one. No sharps box. Just raw dog and everything. There wasn't even alcohol swabs. No alcohol swabs. We're not swabbing that. And then you have to do an IV in you and an IV in the other person, and you swap blood. I don't know how the Vacutainer on that situation works laterally for that, but you in the wrist, all of this is happening through the wrist. That wrist vein's got to be fucking fantastic. I mean, they're moving bodies around with that unsecured little wrist IV, throwing the tubing in. Even I have taped shit down that Jesus couldn't remove and had something yank it out, and they're just moving things all around, and that never leaves that fucking wrist. Are you fucking serious? What is in that IV? Gorilla Grip? What? Gorilla Glue? What are you doing? Anyway, however long they're down, they just leave them naked there. No pressure sores. They don't even cover them with a blankie. Does I put the thermoset in? Like, obviously things happen to the body because it does. And you keep, no sterile technique because you keep going through the pus to get more. Again, I said spoilers. So that isn't an infection risk. And you raw dog that pus-filled thing into your leg. But no pressure sores for months down on one side. I mean, granted, something worse than a pressure sore happened, so. But still, 7 days not moving on tile is not going to leave the pretty body looking pretty either. So this is a do-it-yourself home kit of blood transfusions, IV drug administration, TPN administration, and random lumbar puncture CSF transfers. That's the average person in this can intuitively do. Also, this is a good example of why you don't reuse single-use vials. Something bad might happen. That shit was probably expired. I guess that Google Medical, they don't even Google it. They just act like, oh yeah, this is totally, I totally know what to do. Has anybody assisted with a thing and you're seeing the doctor open up like a central line kit or something and you see him pulling the stuff out? Do you know steps 1, 2, and 3 without being told? Or at least watching it once, like floating a swan or whatever. Like I feel like anyway. This is like doing your home, do it yourself bone marrow biopsy. Like, oh, I'll just give me the kit. I'll do it. It's good. I'll send it in. I'm fine. You don't need to tell me how. I would love to say I thoroughly enjoyed the movie. The last 20 minutes or so got weird. Really weird. Zan, I looked at Zan at one point near the end, if you've seen the end, and I'm like, somebody would still fuck that. And she goes, yep, it's got a face. We both agreed that was still fuckable. But the boob birthing was an interesting touch. Just right out. Like, anyway, like, I enjoyed the movie. But I was not. Zane was just looking at me because I was like, oh, bullshit. Like as soon as she opened up the box, it's like, there ain't no way nobody's gonna feel that. What? I am not one to watch these kind of movies with. I can suspend belief, but still, it only goes so far. Because I have practical questions. But I still enjoyed the movie. She deserved her award, for sure. But the last 20 minutes got way weirder than I maybe thought. Way weirder than I was. Zane kept telling me, oh, it's still okay up to this point. It's still okay up to this point. I'm like, it gets worse. She goes, oh, yeah. Demi Moore deserved her awards. I hope I look like her at 60. Like, really do. I've only got 10 years or so. She's only got 10 years or so on me, so. Actually, it's exactly 10 years. She's 10 years older than I am. I looked it up and checked because I thought so. And, that was a lot of arterial spray. Like, a lot at once. At the end, it was like Carrie-esque. Carrie and The Shining coming together, I guess. But every time I tried to get into the movie, the medical part of it just kept pulling me out because I was like, I can't. It hit too hard, my brain. It hit too hard. So, if you haven't watched The Substance, I do recommend it. It is a good movie. It's just really weird. And if you're a nurse and watched it, I'm just curious if you had the same questions. Or did I miss how to do a lumbar puncture day in high school and in nursing school? Or that YouTube video? Did I miss it? And I'm posting this because I had to get it out of one of the back burners in my brain to share it to other people's brains so that squirrel could just leave that nut alone and go find another one to play with. So, thank you for letting me question dump. Oh, and lastly, this shows the importance of not reusing single-use files. If it says do not reuse, don't do it.